I think the title was something like, "What can we do for patients with medically refractory epilepsy?" So what we can do is refer them to epilepsy centers. So I started out by saying that this is something that I've been wanting to talk about for a long time, but I'm very nervous about it because I have a serious conflict of interest, and that I'm a director of an epilepsy center. And the point that I wanted to make is that although there is a lot of cutting-edge research being done to improve the diagnosis and treatment of people with epilepsy, and there are advances now, that the most important thing that we can do to improve the quality of life for people with medically refractory epilepsy immediately is to refer them to epilepsy centers. The term medically refractory is meaningless now because we have so many drugs that it's not possible to prove that a patient is not going to respond. To try every single drug would take a lifetime, literally. But there's lots of evidence now showing that if patients fail 2 drugs as a result of inefficacy, not intolerance, that they have a 3% chance of ever becoming seizure-free on medication. So the International League Against Epilepsy has defined medically refractory epilepsy as failure of 2 appropriately chosen anti-seizure drugs due to inefficacy, not intolerance, alone or in combination. The fact is that 40% of people with epilepsy continue to have seizures despite adequate medical treatment. And with 20 or more new drugs that have been introduced in the last few decades, that number hasn't changed. So what that means is that the drugs that are being produced today are treating the same population of patients and getting the same effects with different profile of side effects. And patients who are pharmacoresistant are a different population that we have to address. What I talked about is that this is a serious problem, that according to the World Health Organization, the global burden of disease represented by epilepsy is equivalent to lung cancer in men and breast cancer in women. It doesn't get the attention it deserves. The consequences of medically refractory epilepsy in infants and children are developmental delay, resulting in institutionalization. In many cases, in adolescents and adults, there are problems with acquiring the interpersonal skills and the vocational skills that allow them to go out and work independently. There are behavioral disturbances like depression is very common. Then there's an increased morbidity, and the mortality rate in people with medically refractory epilepsy is 5 to 10 times that of the general population. And it's not just due to SUDEP, sudden unexpected death in epilepsy, and due to accidents, but also due to suicide because of the depression. So this is a serious problem that needs to be addressed. The statistic that I wanted to emphasize yesterday is that less than 1% of patients with refractory epilepsy are referred to epilepsy centers, where there is specialized personnel, not just neurologists, but neurosurgeons, neuropsychologists, psychiatrists, social workers, counselors, trained to deal with people who have refractory epilepsy. So there's something that I refer to as pseudo pharmacoresistance. So it may seem to the community that patients are pharmacoresistant, but they're really not. And it may be that they're non-compliant, or it may be that they've been misdiagnosed and they don't have epilepsy at all. A third of the patients that are admitted to epilepsy centers don't have epilepsy. They have non-epileptic seizures, usually psychogenic non-epileptic seizures. Or they may have been diagnosed with the wrong epilepsy syndrome and treated with the wrong drug, or not enough drug. Or they may have lifestyle issues like repeated sleep deprivation or substance abuse that causes seizures. And then there's obviously a hardcore of patients that are not going to become seizure-free with everything that's done at epilepsy centers. So the epilepsy centers can address the psychosocial consequences of seizures that cause disability. And that's the major problem of people who have seizures, is not the seizures themselves, but the psychological and the social consequences. So epilepsy centers have psychologists, psychiatrists, social workers, counselors, people who are trained to provide support and help people deal with the seizures. And the vast majority of people with refractory epilepsy don't have access to this because neurologists don't refer them.